Hello and welcome to the Clinic Studios. I am your host, James Hall, and today we have a very special guest. We have a special guest by the name of Mr. Sam Shorter. Now, Sam Shorter is with the clinic. Sam has a wealth of knowledge when it comes to this topic, gentlemen, that we're about to touch on. And we're going to get down into the weeds. We're going to touch on ED. What most people don't know or understand is that over 30 million men in the United States of America are affected by this phenomenon, is what we're going to call it. And we're talking 1 out of 5. So every 5 men you see walking by, one of those gentlemen are dealing with ED. The idea here today is to pull the wool back so everybody can see that it's not as bad as you think it is, because there's definitely some things that can be done and some things that we can be touched on here. This is the reason why I have Sam here in the studio today. I'm excited to bring him to you. Like I said, a wealth of knowledge. One of the things Sam had brought to my attention was that, did you know that 18% of men 5 under the age of 25, 18 to 25, are dealing with the same epidemic and this issue, which blew my mind, by the way. So it just goes to show that's just something that's prevalent. It's out there, and we're going to touch on it a little bit. So, Sam, I'm going to introduce you to the platform. Go ahead and just tell us a little bit about your background and, shed some light on this epidemic, man. I mean, like I said, I've had the chance to talk to you and get really, really deep into the weeds about this issue. And I mean, I'm stunned at the amount of men that will not confront this problem. And it's, in most cases, it's a fixable issue.
Well, yeah, I would definitely say that, but well, first off, just to get started with a little bit about my background is as working in the ED space, working predominantly with men, generally speaking, guys 50 and up, but increasingly over the past, I would say 5 to 7 years, that low baseline number has been getting progressively lower and lower and lower. So
Oh.
now you have men in their early to mid 20s uh, coming in with the same issue. With that being said, I do want to establish that I do believe that although this issue has become, like you said, of epidemic proportions, this phenomenon, I do think there are divergent reasons between the demographics. And so, for your men, typically in that 50 or older demographic, typically the underlying causes of that are related to certain chronic health conditions. Right, that most people are going to, many people are going to experience. Your guys with maybe diabetes, high blood pressure, kidney, liver issues, and so on. But something insidious when you touched on why aren't people talking about this? There's everyone knows about the stigma. Like when we're young, the last thing that we're thinking about is our tool going to perform, right?
Right.
That's the last thing we're thinking about. We've already got it planned out, right? And it's awesome because if you have a parachute, right? The most well prepared person has a what? They have a backup parachute. Well, what do you have a
Right.
backup parachute, right? I mean, you
Right.
have a parachute. Don't you trust it? It's like, well, yeah, I do. Then why do you have the backup, right? And so, even with spirituality and religion, we face certain issues in our life where we experience doubt. But as I can say as a man in my 50s, that you know, there's no doubt. If you ask me, hey, if you get a shot at that, oh, I'm gonna tell you what I'm gonna do, how I'm gonna do it, what the outcome is gonna be, right? And so that's never something that we're thinking about, right? But when ED occurs, right,
Hmm.
even in its most mildest form, it's insidious because what happens is it becomes all the man thinks about. So
Mm.
it goes from something that they never question to
Mm.
something that becomes all encompassing in every aspect of our interactions, internally and externally, with our partners, with our coworkers, with our associates, with our friends. It starts to affect everything, and it just gets progressively worse. And then the person withdraws, and they don't want to engage not only in sex, they don't want to engage in intimacy. Ultimately, they don't want to be social. And that leads to increased aspects of depression, anxiety, so on. It's a cascading effect. It's very catastrophic. But that's one aspect of it affecting a certain demographic. When we talk about this new thing, we're still getting information on this phenomenon. I'm going to refer to the one as the epidemic. With the young people, I'm going to refer to this as the phenomenon.
Right.
What is going on We get this
Right.
we get this young guy that walks in the clinic and we're like, oh, you took a wrong turn. The gym's downstairs, right?
Absolutely.
And so, but it's like no, they have an issue. Something that I've noticed, however, with our younger men is that it's something that's almost normalized. And so what I mean by that is it's if you want to do this a certain way sexually, then you need to take these
Right.
drugs or go through this in order to perform in that way. So it's
Right.
something that I've noticed now that apparently it's been going on longer than we've even known about it because the younger guys don't come in oftentimes. I'd say about half the young guys come in like, yeah, I needed this because I need to do this, this, and this. It's almost like I said, it's been normalized. Now you have a certain other aspect of young guys who like, yeah, I kind of have this problem, right? And so, but that's something very different than what we're traditionally used to in the space, right? And
Right.
so, and so there's what we discovered is particularly with our younger demographics is that there's it's a psychogenic component
Yes.
to it,
Yes.
and that's an emerging pathway of discovery because men often are not associated with intimacy when it comes to sexual performance.
Right.
That is something that traditionally is associated with women. You make her feel a certain way, and now that she's feeling in the mood, she's experiencing certain emotions, love, caring, commitment, the ambiance of it, all of
Right.
those, the bended knee,
Yeah.
all of those things going to candle lights, all of those things, the sunset, the waves, the ocean, all of those things are associated with, romancing the stone, right? To make the
Right.
experience great, not just for us. We're going to get ours, but for them, right?
Right. For
But
sure.
there is, what we're discovering is that there is an emotional aspect, there
Hmm.
is an intimate aspect that happens within the male psyche that
Right.
does contribute regardless of age demographic of manhood. There is
Right.
something with that. And although we're not consciously aware of it, this exists. And what we're discovering in today's connected world with media, with the internet, I mean, look at us right now. I mean, we're
Right. For
worlds
sure.
apart, right? But we're communicating here in real time.
Right.
And so, with that, we're discovering some external factors. And we will expound upon that, you know, but that are contributing to the male psyche that is causing indirectly this erectile dysfunction amongst our younger
Right.
people. And so we're definitely learning more and more about that as we go. But it's
It's crazy, man.
amazing, yeah, like wow,
So one of the things I know, one of the things we touched on before, when you were talking about the psyche, right, of the
mm-hmm.
young man, and then we found out that a lot of it was due to the the fantasy that they create, or the fantasy that they think
Mm-hmm.
that needs to happen
Absolutely,
for a relationship or for the act. And let's
the
call it what it
act
is. Let's call
for
it what
the
it
act,
is for the act, right?
absolutely.
Let's
I'm
just
glad
call
you
it what
brought
it
that up.
is.
Yeah, and that's what it is.
Pornography had became one of the biggest components and contributors to that because these young people have taken this in and this is normalized to them. So
Mm-hmm.
when they are in the real setting and they have a real opportunity, they're not showing up because it's not the norm to them, right? And then they think they have a problem. Now obviously they do because it's still a form of ED no matter how you look at it, right?
Yeah, there's just a different root cause of it, but the
Right.
outcome is still the same. Hey, my car is dead. Well, your issue is a battery. Your issue is spark plug. Your issue is a blown engine, right? And so, with that being said, all roads still lead to the same place, but how we got there is of key importance because it determines what pathway we're going to use to treat that patient. So,
It's one of the things that it didn't trigger me, but it let me know. Now, I mean, of course, I've dealt with that issue before in my lifetime. Now, obviously, it's because I've had some ailments that I was dealing with, and I was on a cocktail of medications, and this is before I really knew medications could cause you to have ED. It is what it is at times, right? And I'm grateful. I'm so grateful that I'm beyond that point in my life. But when you find out that the United States of America is leading in this ED epidemic, and we're going to keep calling it because it's becoming an epidemic. When is the last time that you heard that from 18 to 25 that you have a 14.2% that ratio? are dealing with ED. These are kids, man, right?
It was
And
one in a
then
million. It's 1 in a million.
right. So now you take in consideration that the contributing factors are your lifestyle and the health factors. You have no diabetes, you have obesity, all these contributing factors, hypertension, depression. Um, those are all major contributors. But the number two is pornography. The high porn consumption and the screen time spent have changed everything from that psychogenic ED complex because it's no longer a complex, it's a real issue. So, but at the end of the day, the bottom line is, if it's not talked about, because it's 1 in 10, dude, 1 in 10 men actually go to a physician and talk about this to get help. And the other men, the stigma, everyone that you
Keeps
bump
them away.
into,
Well, and there's a combination of the stigma that's associated with it. Also, another insidious thing is that many men have sought, certain fixes repeatedly in the past. Everybody's turned on the TV, everyone's listened to the radio at some point, and it doesn't matter. You're always going to hear, "Hey, call us up, fix it. We have something for you that's going to fix this." And then you get there, and it's the same thing that they've been using, for the past 35, 40 years to treat erectile
right,
dysfunction. They just keep calling it something different or
totally
presenting it in a
different.
different way. And so people become jaded that it's just the same old thing. It's a myth. It's the same thing. It's the partner that promises and never shows up. It's the
Right,
dad that's never there at the baseball game.
right.
And so that is very discouraging. And so in the absence of encouragement, unfortunately what happens is there becomes a resignation. People just say, "Hey, it is what it is." And
Right.
I just have to go on with other aspects of my life. The problem with that is we touched on that at the beginning,
Yes.
is that this is insidious. It's part of sexuality is human sexuality, male
Yes.
and female. It's actually part of who we are. And so, like spokes on a wheel, once you start pulling out, it gets warped, and that warped tire affects everything else going on with your car.
Oh yeah.
So
Yeah.
it's not something that you can run from. So when people say, I use this word, how long have you been suffering? Sometimes people are like, don't be so dramatic. At 55 or I'm 60, I have kids or grandkids, or I've had my share. It's not like I'm so. You are. It's suffering, right?
Yes.
Let's call it what it is. And so that's the thing we want to do as far as encouraging conversation, getting into the weeds, if you
Yes.
will, with this,
Yes.
because I do think that's something where women definitely have an advantage
Yeah.
over males, is that women feel that they can air these things, come as a community and have certain discussions, right,
Yes.
more readily than right. And
For
so
sure.
I think that's something that we really have to work as advocates in having those people suffering participate actively in these conversations, right? And that in turn will encourage other people to participate more, and ultimately it definitely advances treatments, right? Whether
Right.
working or not working, right?
Right. Right.
Conversation. We need the
Right.
feedback. We need people to open up. Like I said, we're now finding out that young people have this issue that is widely attributed to, like you said, psychogenic. And COVID really did a number on people because people were isolated and they had to look elsewhere for sexual gratification. And so they're getting that through synthetic means. And for many of our young people at a time when they're just coming into their sexuality, their sexual identity. And then now they're receiving this information that's really for entertainment value only, not meant as a guide in terms of how you should perform or what a sexual partner should be.
Right. Right. So, one of the things, and I think about this, it's not just about little blue pills. It's not just about, Cialises or whatever medications out
Right.
there that are working or don't work or whatever. But it's a real epidemic, man, because right now we have a bunch of band aid fixes. Now, I know that your clinic takes pride in root cause therapy, and you're one of the only ones that use particular therapies that change the whole game when it comes to ED. I understand that, which kudos, because like I said, I've had to visit myself, right? And it worked out for me as well. With all the other things that the clinic does, it's just super exciting. But more than anything, I want men to know, listen, there is help. All you have to do is have a conversation. Because, I mean, now if you're okay in your space where you're at, now let's just call it what it is. If you're a man with ED and you're married, it's not just your issue, right?
Absolutely.
It's your
For sure.
spouse's issue as well,
For sure.
right? And then you start to run into those feelings of, rejection and confusion and frustration and, sexual friction and guilt, helplessness, fear. And that
Oh
fear
man.
comes from not connecting or possible divorce, man. You understand what I'm saying? It's a bigger issue because it's been stifled, not talked about. Now you've got festering issues, right?
Yeah,
So,
what we don't know, the brain is going to fill it in. Something has to go into the void of the unknown. And
right,
so what we don't know, we create. Something's got to go in there. So
right,
if if you're not with me, a buddy of mine from my military days used to always say that if she's not with you, she's with him.
right, 100%.
It was as binary as that. There was
Wow.
no in between. If she's not with you, she's with him. And then
Right.
that turned into when she's not with you, she's with him. So it's an
Yes.
insidious mindset that doesn't exist outside of reality. Could that be the reality? It could be. It's like Schrodinger's cat, right? Is it
Right.
alive or dead? You don't know until you open the box.
Open the box.
That's what, and yeah, and that's my thing. I got to get the patients to open the box so then we can treat reality, right, with the solution. Otherwise, we're just talking. I'm just throwing things at them. They're not my head. We're not going to do that. Patients aren't a dartboard. It's kind of like you take your car to the mechanic, and they're
Right.
asking you all these things. I'm like, dude, I'm not a mechanic. I don't know. That's why I brought my car here. You look at it and you tell me what's wrong. Why am I telling you?
You know,
Right? I told you it's making a noise, but outside of that, I don't know. Now, to contrast that, some patients come in and they don't even want to say that. They're literally like this because
yeah.
it's such an uncomfortable topic,
Oh, it's horrible.
or they opened up before, and nothing satisfactory for them came of it.
Right.
And so they're literally only there because their spouses, to your point earlier,
Mm-hmm.
have said, look, you got to do something.
Yes.
Okay. So, and even that is good because that means at least they had some acknowledgement,
Right.
right? That it's not you, it's me.
Right.
Right. And
100%.
because oftentimes that doesn't even take place.
Right.
And so
Right.
meanwhile, the significant other is sitting there like, maybe they outgrew me. And you hear
Right.
that. People say, we just grew apart.
Yeah.
Do you think Brad Pitt's gonna come on TV and say, "Oh yeah, if Angelina Jolie says we grew apart, you think he's gonna come on TV and be like, "Oh, it wasn't that. My penis wasn't working."
Right. No.
He's never gonna say. No, I'm not saying that was the case with them, but I'm just
Right.
saying if it was, who's
Right.
gonna say that?
Right.
That's gonna damage my brand, and that's it. We all have a brand. And,
100%.
and for every man, whatever your persuasion is, whatever your background, whatever your ethnicity, it is tied to our male libido. And you start messing with that. It's a cascading issue. I can't say that enough. And
Yes.
it even goes even past this that there are other health issues that are
Right.
typically associated with the erectile decline or the erectile dysfunction.
Bingo.
And so there's a reason why guys 80 plus, only 1 out of 10 of them have a form of erectile dysfunction,
Right.
but guys in their 70s, 70% have that. And for the longest, it was a head scratcher. Then we
Right.
figured it out. Those guys that were 70 that had erectile dysfunction, they never made it to 80 because the reason they had the erectile dysfunction was because of their heart disease, their prostate cancer, all of
Oh,
these other issues, their
right.
depression, their anxiety, their sleep apnea, you name it, right? And so they never became 80. So that's what was skewing the numbers. And so
Right.
ED can be a positive thing in the sense that it can highlight
It's an
some
indicator.
aspects, yes,
Yes.
of health. And as a healthcare provider, as responsible healthcare providers, we can steer patients and treat those other conditions. And in some cases, just treating those conditions in of themselves, in some cases, when treated early enough, of the erectile issue.
Bingo. So, one of the things that's funny that you're touching on this because Dr. Roberts and I had this conversation a couple of days ago. She said, well, once they have ED, something's already wrong. And I was like, well, what do you mean? She said, ED is just a byproduct of something else going on. So if it gets there, there's something else that needs to be looked at, something else that may be corrected, which again,
ED is that rare thing that is a disease and also a symptom of the other disease.
right, right.
That's the binary nature of it. And so it's like if I have my arm tied behind my back, right?
Mm-hmm.
I'm a lefty. Okay, so you tie my left arm behind my back and you untie it every night when I go to sleep. Assuming I'm getting, 8 hours of sleep a night. So for 8 hours a day my arm's free, right? But it's free while I'm resting. Okay.
Right.
So in 6 months, two things are gonna happen. This arm's gonna be hella small, and my non-dominant, my right, is gonna be hella big because
Yes.
it's doing double duty now, and this one's
Right.
not doing anything. And so now I have a new hand to masturbate with, right? So this one's lost all privileges. It's not even getting that anymore. And so with that being said, um, it, it's like you say, oh, well, what's going on with my arm? And you say, oh, it's tied behind your back,
Mm-hmm.
right? We figured it out. And so we're going to cure your issue by snipping this cord and untying your arm, right? And
Right.
you say, oh, so I'm cured now. No. Well, why not? Well, because the whole time your arm's been back here now, it's all atrophied and super weak. Okay?
Right.
So now you need therapy
Great
to help
analogy.
you build your
Yes, great analogy.
to build your arm back up. And so what's been happening in the ED space is that and there are steps here. It seems like we've just been for the longest we're just in one space where we're treating ED by its blood flow, right?
Mm-hmm.
So we're just going to give you some form of drug that is going to increase blood flow, right? And that should get you the erection, right? Treat the underlying issue. So that's like telling me to go through physical therapy while my arm is still tied behind my back. Okay, well, you never untie my arm, so I'm doing all this therapy, but it didn't fix my arm. So I got all this
Mm-hmm.
blood flow going through my body, but I'm not exercising my arm. Right? Now on the back end, you say, oh, I've released your arm, but then they're not doing the therapy to regenerate it, right? And so that's kind of what we've been doing here, where
Right.
I fixed my A1C, but my penis still isn't working. Well, yeah, because you let your A1C stay at catastrophic levels for 9 years, sir. So you
Right.
have 9 years of atrophy on your penis. Oh, I
Right.
stopped taking metformin, but my penis isn't working. It used to work when I didn't take it, but
Right.
now it's not. Well, again, this has been going on for so long, you now have atrophy. So that's the analogy, like I say, with the arm tied back here. So now, with current breakthroughs that we have in medications and treatments, is that we can now do the whole thing. We can
Yep.
treat the causes, the main causes of
Yes.
erectile dysfunction, and at the same time, we can address issues. We can address the psychogenic components and the
Yes.
physical components. So we
Yes.
can we can do a 360, a holistic approach to this to go along with educating the patient, and that's what makes this so exciting right now. I mean, I've helped thousands of patients,
Yes.
but and don't get me wrong, I mean that feels great. But I can't name them all, but I can name every patient in the past that I couldn't
Right.
help. Okay, and so to know now that we can go back and reach out, and we've reached out to those patients to say, hey, and they're like, sometimes they're like, oh Sam, thank God you called. Tell
Yes.
me you got something good. Tell me you got something good. You know, and so they're very excited, and when you see that you can finally go back and help those people, it's just a great feeling. It's indescribable.
So you said something, and it's a whole different conversation. It's a whole nother conversation, and I promise at a later date we're going to jump into it, folks. But when you were talking about that 360, that holistic 360,
Mm-hmm.
a lot of times men have this question, because if you don't use it, you'll lose it. You said atrophy, which is a real thing. Yes, men, if you don't use it, it will get smaller. That's just what it is. So, with that said, can the penis grow? Can it get bigger? I remember talking to you, and you're like, that's almost everybody that comes in asks that simple question. And we're going to tell the public right now that yes, it's possible. Yes, they have a program called pH factor, penile health and growth factor. It's phenomenal. It absolutely would take the place of a PRP in this instance, and it's permanent growth, girth, and length. Hey, don't shoot the messenger. This is legitimately one of the most impressive things I've ever seen. And ideally, it's just where science is taking it, right? So we'll touch on that. We're not going to talk about that right now. But can it grow? Yes, it can grow for sure.
Absolutely. Yeah, just like it can atrophy,
Just
you
like
know,
it can
just
atrophy.
like when bones break and they can heal stronger.
Yes.
Same
Yes.
principle.
So, I mean, as exciting as that is, I mean, I know the phones will be blowing up going, hey, man, can I get that pH factor you were talking about? But hey, it is what it is.
And it was looked at, just to touch on that real quick, and that's something too that was to a degree was kind of frowned upon a little bit. It's like, well, what do you need to make it, bigger for?
Yeah.
Just explaining that these are people that have been suffering for years.
Yes.
They've had atrophy,
Yeah.
okay, and so, yeah, we want to, and I'm showing my age a little bit here, but you remember this, bigger, stronger,
You're
faster. Dun,
faster.
dun, dun, dun. Lee
Yes.
Majors running there, 66 seconds.
Look, it's funny you make that reference. I just said to Dr. Roberts, I said, I remember it felt like you looked at me and said, we can rebuild you like the $6 million man. That's so funny, dude.
Oh
Oh
man.
man, dude. I am so excited to have this conversation. I'm so excited for us to touch the men the men in the community, right? And when we say the community, it's everybody up under our auspice and our voice right now. And I need every man out there to know, listen, you are not alone. You absolutely are not by yourself. You can band together in this a community like this. You can get all the education that you want and you need. You can get services if you need it. You would just have to go drop in the link below and take a peek, and you can click and go to their website. You can ask all the questions that you need to ask, but it's worth it to ask because it's a problem that probably isn't big as you think that it is. I thought all was
It's a double
lost.
entendre there.
Huh? I thought I was lost, man. I came back from them blood clots and I was just grateful to be alive, right?
Exactly.
I wasn't here for a moment, then I was here, right? So, but the medications, then it's just nothing. I couldn't do anything and I thought that was going to be it for me, right? But lo and behold, again, it wasn't that way. And I'm grateful. I'm grateful for finding a Dr. Roberts and her team. I'm grateful for the introduction fully to the clinic, to the world, because we're trying to do this for as many people as possible, man. Because you
Yeah.
don't know what you don't know. And on that note, I don't want to hold you up. Sam, I appreciate you jumping on. Dude, I know you deal with clients, patients all day
Just
long.
another 14.
And I sit there and I think, I'm like, he's the most meek, most somber. And that's the reason why he's a senior VP of patient client, acquisitions, we'll call it, because he deals with every patient that comes through the clinic. He touches everyone and he does it with such compassion and he really just tries to get to the root cause. And if there's nothing that can be done, obviously he'll be the person to tell you that. But overwhelmingly, we were helping people that, no, I've done this and I've done that. That didn't work and that didn't work. And I have a story real quick about a 70-year-old man, great athletic shape. He became a client. He took one of, the medications that was prescribed to him by Dr. Roberts. He called me up and he said the drought has been broken. And I didn't know how to take that because he's 70 years old, man. Listen, you can't teach an old dog or anybody new tricks, right? Like they're going to be who they're going to be. But he was so authentic and he was so happy and he was so excited that he had to tell me that, dude. That
Absolutely.
made me feel amazing. Just to say, hey, this gentleman called back in just to say that. I said, man, wait till I tell Sam. Wait till I get a hold of Sam and tell Sam this. Because Sam, you have a whole bunch of stories and they are all good. And I mean that in the best way, most humblest way possible. I've learned so much from you in this sector and how you deal with people and how you get people to understand that they're in a safe space, man. That there is a fix, man. And my hats are off to you. My hats are off to you.
That's the thing. I mean, when from obviously, with my patient advocacy, background is that it's an interesting dichotomy here with the in this particular space because it's a little less versus other healthcare spaces where someone says I need someone to advocate for me, right?
Mm-hmm.
We've lost parents, you and I,
Yes.
and where they're advocating for treatment, right?
Yes.
It's like, look, don't leave our loved ones on the side of the road.
That's right.
You're not gonna give up, right? And so if we can get 2 days, 3 days, 6 months, 2 years, whatever it is, we're going all out, and we want quality during whatever time that they have.
For sure.
And so in many healthcare spaces, that's what the role of the advocate is that you're advocating for that person for this favorable outcome. Leverage everything at your disposal to get them a favorable outcome. But we don't have that issue here, right? We're
Right.
doing everything we can to get them. So my role is a little bit different in this space in that it's really rekindling people who are despondent to advocate again for themselves
That's right.
because you really come across people that are just so downtrodden, so disenchanted that they know there's an issue, but they're not even advocating for themselves anymore because they're just in that much despair, right? And so
Yeah.
that's the biggest challenge. That's why we strongly encourage people. We want to tell these stories so that people understand that hey, there are more options out there. Men, especially, we're really solutions oriented.
Yeah.
When we get into a mindset that there's just nothing out there, we can become very jaded. And listen, like we said, ED not only is it a precursor for diseases, also it's saying that hey, you have some diseases. So it's the chupacabra, right? If you have
Mm-hmm.
ED, you're more likely to die from these things. If you have ED, you're more likely that you already have these things.
Right.
And
Right.
so people oftentimes in their reticence they reduce it down to a simple matter of intimacy, intercourse as something that's like a pastime, right?
Yes.
Anymore. I'm 70. My rugby days are over. I'm not Air Jordan anymore. I'm Floor Jordan. Right?
Right.
I'm Kobe Bryant. There's only so many jumps left in these knees. Right? So, I'm LeBron James. Well, no, he's 805 and he's still going. with that being said, with that being said, that's what we want to let people know that this is a health issue. This is not a matter of convenience. Now, with the lifestyle that people have become accustomed to, there's often this underpinning that yeah, I can be Tom Cruise. I can keep jumping out of airplanes. I can keep doing action movies.
Mm-hmm.
I can keep doing all of these things, but I can't keep having sex simply because I'm old. No, not only can you keep having sex,
That's right.
it is vital that you continue to have sex
Absolutely.
so that you do have a better quality of life
For sure.
in your later years. This is a time where over half of our patients, about 60, 70% of our patients are coming in when they've made the sacrifices in their lives. They've
That's right.
done the good work. And now there comes a time when they should be reaping the ultimate rewards of that. And such a significant aspect of their life is now they're not able to enjoy it. And not only is it impacting that, it's impacting their longevity. And so that's what we want to do. We need to encourage people
Yes.
meet with our providers, get on a treatment plan. You got to take that first step.
Yes.
Don't give up.
Man, listen, when you hit the nail on the head, man. Again, it's always a pleasure talking to you. And I do want to say thank you. Like, we both lost parents and I know for the folks that don't really know us, we're an open book here. But, I went through a very traumatic loss of my father. My father's passing. It changed me, right? And at the same time, I have this gentleman right here that I will call friend that reached out, was compassionate, was just an amazing friend, standing in the gap. And then he had that issue happen where he lost his father. I mean, they were almost back to back. They were back to back, as a matter of fact. So we definitely understand what it means to advocate for someone who cannot advocate for themselves. I call you a hero in that regard, man, because you were swinging for the fences, man, and that's I'm grateful for that. On another note, we're just going to recap real quick. ED, it affects 30 million men in the United States. The average age of ED is 47, and it gets slimmer year by year, decade by decade, it seems like it's dropping 10 years, right? 1 in 5 men are experiencing erectile dysfunction. Young men are not exempt anymore. So you have to take care of your health because now you have young men that are, 18% of the issue. That issue is happening to them. And that's under the age of 25. 18 to 25? Really? And less than 10% of men ever even have a conversation about it. We've got to do better than that, gentlemen. We've just got to do better than that. And we're here to answer any questions that you have. I'm just excited that again we were able to have this conversation. And women, you're not exempt. That's a different topic. Dr. Roberts is very excited about touching on that. But would you believe that over 40% of the women in the United States of America are currently suffering from a sexual function disorder? A sexual function disorder. They're going through it too. The numbers are staggering. We'll jump on that. But what we'll do now, like I said, I know this man he's a busy man. He's been busy all day long. So we're going to go ahead and we're going to sign out. And I'm going to wish everyone good health. I'm going to wish everyone good wealth. And I'm going to wish everybody a complete harmonious balance of mind, body, and soul. Thank you.
Healthy, wealthy, and svelte.
There you go. Stay tuned. We have another episode dropping soon. We'll talk later. Thank you. So we'll